guys, welcome back to my YouTube channel. In today's video, we'll be looking at one amazing structure here called iliotibial tract, also known as iliotibial band. Okay, so this structure here is a strong fibrous connective tissue that extends from the hip, mainly the iliac crest, down to the lateral side of the knee joint. Okay, so we are going to look at their origin, we are going to look at their insertion, we are going to look at their function and associated clinical consideration. Okay, so let's look at the origin of this structure here, iliotibial tract. So iliotibial tract originates from iliac crest, and it also has some origins coming from the fascias, coming from the gluteus maximus. Okay, and then it envelopes this muscle here called tensofacial lacta. So fascia is coming from the gluteus maximus, and tensofacial lacta unite to form this iliotibial tract. So the iliotibial tract now runs down laterally anterior to this muscle called the vastus lateralis, and it now inserts in this area, this lateral condyle of the tibia, and then it's also inserted at this patella as well. So that point where it's inserted at the lateral condyle of the tibia is called the Giddis point. Okay, and this iliotibial tract, its function is to stabilize the hip joint, and also it helps to stabilize the lateral aspect of the knee joint, and it also helps to transfer forces generated by this tensofacial lacta and the gluteus maximus down to the lower leg, and it also helps to maintain a proper alignment of the lower limb, and it helps to stabilize this joint in walking activities, jumping and swimming. In some clinical abnormalities, like what we call the iliotibial tract syndrome, where there is irritation of this iliotibial tract, maybe as a result of contraction of the gluteus maximus, it's always common in athletes, people that have done strenuous exercises where there is excessive contraction of these muscles or friction, resulting in impaction of this nerve, this iliotibial tract here, resulting irritation, pains, especially at this point here, this Giddis point, where this inflammation is localized at this point here. Okay, so in iliotibial tract syndrome, it's as a result of tightness of these muscles, and then tightness within this tightness coming from the gluteus maximus as a result of irritations and then frictions in the iliotibial tract syndrome. Thank you.